Regarding your health care, just where are you? Are you where you don't want it, you don't need it, you don't have any, you know you need it but just can't afford it? Or maybe you want more affordable coverage than you have because you'd like to get more? Or you need access to more doctors or want a more complete plan? So, let's start with you don't want it or need it. In which case, we can't help you. Just exit and go on with your day. But if you don't have any, you know you need it, but just can't afford it, maybe the solution would be our Select Silver 2750 plan, the basic plan. This is our lowest cost plan. It's a catastrophic plan, which basically means that you don't get day-to-day doctor visits, that kind of thing. But if you have a major event, like a heart attack or an accident or something like that, then you have coverage. So it protects you, and the most you have to pay is $2,750. No doctor visits. You still have the $2,750 deductible. No co-insurance, which again means you hit 2750, you're done. You also have access to doctors via telemedicine. 3 out of 4 doctor visits can be eliminated anyway with telemedicine. You talk to a real live doctor and you can have a video or a talk with him 24/7, 365 days a year. And you have $1 million lifetime benefit coverage. Or maybe you want more affordable coverage than you have now, and you'd have access to more doctors and hospitals. Well, the solution could be the same program, but our PCP Elite version of this plan. It's a complete comprehensive major medical coverage, has that same deductible, has no copay after the MRA. You have access to any doctor, any specialist in the United States. How big is that? Access to any hospital. Annual wellness visits, so you get your annual physical at no charge. Telemedicine, again, you have access to the doctor. Drug coverage, and now you have a $2 million lifetime benefit. So maybe you want more and more complete coverage. Solution could be our Lifetime Plus plan, which has all the benefits of the PCP Elite plan, but it gives you $3 million worth of lifetime coverage, which is plenty because to date, after 20 years of being in this business, 700,000 is the most I've ever had to put out for anybody so far. Make your plan even more complete with these supplemental benefits. You can add disability, critical illness, gap, and accident. And the way this works is that say you have an accident and they'll pay you up to X number of thousands of dollars, depending on your level of coverage, that goes directly to you, that'll more than pay for your deductible and maybe leave you some money over to help replace the income while you recover. So here's an example of Obamacare, the Affordable Care Act, versus the PCP Elite plan. Mom and Dad are 46 and 43 with 3 kids. The Silver plan from Affordable Care Act is $2,400 a month, roughly $29,000 a year with a $5,000 to $10,000 deductible, and you still have to pay 20% coinsurance. Or you could use our PCP Elite program, pay $624 a month for an annual amount of about $7,500, $2,750 deductible, and no coinsurance. Which one works for you? Here's a bronze plan, which is kind of what their version of the catastrophic plan is. Still $2,000 a month, $24,000 a year, high deductibles, and still have 20% coinsurance. Or you can use our basic program, $325 a month, around $4,000 a year. That's 1/6 of the bronze program. Low deductible, and again, no doctor visits, but you don't have any coinsurance either. What could you do with an extra $10,000 or $15,000 a year? So, how can we do all this? The key is utilizing a healthcare sharing ministry plan from Altrua HealthShare. Altrua is a recognized healthcare sharing ministry program. It's a nonprofit plan, which means members have an exemption from any requirements to the ACA, but they don't need all the profit that the big insurance companies have to have. Altrua Ministries has been around for 20 years and has successfully shared in all the eligible costs since then. So, do you qualify? Yeah, you don't know. Which plans fit you best? We don't know. What questions do you have? And hopefully you've got a bunch of them. So call this number right now. If we don't answer, leave a message and we'll get back to you quickly. And feel free to email us as well at the email address above.